You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, TMJ disorder, what you need to know. With us, we have an expert on the topic, Dr. Landon Blatter. Dr. Blatter, welcome to the program.
Thanks for having me.
So what defines this TMJ disorder or dysfunction? What is it? What are the symptoms?
Great question. A lot of people don't even realize that they have it. And so what can happen is, people they will get a click in their joint. And then every time they talk or when they're eating, then you'll hear a click, click, click. And they're like, okay, something's going on. The other things that people,
and the click, by the way, just for a moment, what's happening in that click? Like, what's making it click?
What's clicking is that we have a disc of cartilage in our joint, our jaw joint, and when our teeth aren't balanced and aren't lined up perfectly with our joint, then the muscles on the inside of our mouth will tense up and they'll pull that disc off and they'll go click, 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 back and forth as you're opening.
Does it only get worse?
It only gets worse.
Interesting.
Absolutely.
Okay.
Yep. And so it's not going to ever get better. Now, the good thing is that we can help prevent it from getting worse, and that would be our goal.
Okay.
And most of the time we can't even get it to go back and be better. But if we can prevent it from getting worse and getting osteoarthritis of the joint, that's our goal in most situations by balancing our system. The other thing that happens is that people wake up with sore muscles. How many people wake up with sore muscles and don't even realize it? And I think it's because
like
they're
a sore
expecting,
jaw.
Yeah, sore jaw, and they don't expect they don't know what to expect because they're just like, well, I'm fine, but they're not noticing the tension that they have. Their whole temporal area and their whole jaw masseter area are just tight. And people don't notice the tightness until it's too late. And so if people are facing tightness in the morning, they've had some extracurriculars
So what was
at
going
night.
on? So at
they
night
were
they're
grinding.
just kind of...
Yeah. And what happens is if the teeth get in the way of the joint being stable, then the muscles say, man, I got to grind those teeth away so that the joint can be in the right position.
So your mouth is kind of looking for a comfortable spot?
It's trying to find a comfortable spot, but they can't because it just can't because the teeth pull the joint too far out.
Interesting.
And so then the muscles, because they're working all night, you wake up and it's just tense. There's a lot of tension and there can be a lot of tightness, and it can lead to headaches throughout the day. And a lot of people do this during the day as well, where they grind their teeth and they don't even realize it. I'm a clencher, and so I clench I used to clench because my teeth weren't balanced with my joint, and I just kind of was constantly biting down on it. And I started to realize that about 5 years ago. Maybe it was dentistry that did it to me. I don't know. There's a lot of stress in dentistry, but it was the joint and the teeth not lining up.
So these are things that you can reverse. I mean, do you have those stories where women, men with migraine headaches, that you do whatever you do to correct this problem and they no longer have migraine headaches? Has that happened?
Absolutely. For sure, and it's a wonderful thing because they've been to so many doctors. They've been to their neurologists and specialist after specialist, and they just can't figure out what's going on with these migraines. And it's natural that they're not going to be able to find the problem or diagnose the correct problem if it's a dental problem. Not all there's a lot of different causes of migraines, but the ones that are dental related can surely be helped and solved by seeing a dentist that has had the training to make sure that the system's balanced.
Okay, so we're talking about TMJ. Now, we talked about clicking and grinding or waking up with a sore jaw. What are other symptoms that somebody may have a problem?
Other symptoms would be as if they're having loose teeth. That can come from gum disease too, so we got to make sure that their gums are healthy. But if their gums are healthy and they have a lot of bone that we can see on the x-rays, then what's causing that tooth to be loose? Something's causing it.
So it's biting in the middle of the night kind of a thing?
It's chewing on it in the middle of the night because it's out of place. And so what happens is it starts to wiggle, and the forces that we put on it from grinding at night are just like braces. What moves our teeth is just a force. Some force of pushing or pulling that tooth moves that tooth. And so if we are grinding on that during the night, we are doing the same biological system as braces. It's just that we're doing it to ourselves and they become loose. And we're not trying to get them into a certain, when we're grinding, we don't really know where it's supposed to be. We just know that it's not right.
Okay. And short teeth. Loose. Short teeth?
Oh, short teeth are very, very common with somebody who has a TMJ disorder because of that same reason. Their teeth are out of position, and so it causes those muscles to just start grinding, and you'll grind them really flat.
Now, you told me that sometimes people on checkups, I guess, that they're told they're grinders and they don't believe it.
Yeah.
Is that true?
Oh, yes, absolutely. But they will start to believe it if we show them pictures. In my office, we take a lot of pictures. And
is it hard to see though on the camera?
No, it's pretty easy.
And what does it look like? Just a flat?
You'll see some flat spots. So it's a progression, just like everything else, where you first start to see a little shiny spot on the enamel. You're like, well, something's going on there, but it may not be causing any symptoms, may not be a big deal. But then as you continue to grind, you'll grind through the enamel. We've been given 2 millimeters of enamel from God.
Okay.
And it's the hardest substance in our body. It's harder than bone, it's harder than fingernails, it's harder than anything else. And if we were to just chew our food and our whole system was balanced, we would go through 1 millimeter of enamel in our lifetime. Sometimes by time some of my patients are already through that 2 millimeters of enamel by the time they're 25. That just doesn't happen from chewing. And until they see a dentist that is concentrating on wear and tear and this balancing the system, they're not going to know anything's going on. There are 3 things that can cause us to lose our teeth. One is cavities. We all know that. Every dentist looks for that. One is gum disease, and we're hoping that our dentists are making sure that our gums are in good health so that we don't lose them that way. And the third thing that not as many dentists look at is the wear and tear and the balancing of the system and the joint.
So where did you learn this, by the way? Because a lot of dentists just don't get involved in the TMJ part of it.
Yeah.
So why you? I mean, why the interest?
It just intrigues me because I started, as I progressed from being a new dentist, you just focus on the simple things. But then you start seeing things and I started seeing things in my practice that I was like, what's causing that? Why is that person 75, doesn't look like she looks like she has a smile of a 20-year-old, but then another 50-year-old has a smile that's been ground down. What's the difference in those two people? So I started researching places to go get some more education. I was like, I need more. And I found the Dawson Academy. They are a comprehensive dentistry philosophy, treating the patients as conservatively as possible,
focusing on that bite?
Focusing on the bite and the joint, making sure that they're balanced.
So you could actually talk about this for hours on end.
I could definitely talk.
I mean, you could bore us all out of our minds.
And I get excited about it. I love it.
But I mean, this is a big topic, right?
Very.
Because I meet some guys, it's almost like a religion to them.
Yeah.
The TMJ and fixing it.
Yeah, and I love it too, just like that.
Good,
because I see so many changes in people's lives
like what?
By noticing it.
Okay, so what kind of changes have you seen where you fix the TMJ? What happens?
They come back in and they're noticing, you know what? I'm not clenching, my muscles are relaxed, and I just feel happier during the day. I don't feel as down, and I don't feel
like they might be sleeping better.
They're probably potentially sleeping better, and the muscles are just relaxed. And so when they're relaxed, we can smile more. And when we smile more, we release more endorphins, and we become less stressed. And
is this a hard, prevention? My program airs all over the U.S. and Canada, and shows on prevention are always the ones that we, don't get any calls on. Okay.
Right.
It's hard.
Yeah.
And this is one of those things. Clicking, teeth are starting to get short.
Yeah.
Little sore. Probably hard to get them at that point, right? Especially men. We like to wait till we can't eat anymore.
Yeah, until we don't have any teeth in our mouth.
So is your thing that get these people in early because they're headed for disaster? And I don't want to put words in your mouth, but I mean, if you have clicking and you have these things, it's only going to get worse and worse.
It'll definitely get worse. And if we can catch it earlier, we can treat so much more conservatively. That's the cool thing.
But do you find that in your practice? I mean, you're talking to a patient, and even the patient, because you don't want to feel like you're selling them on something.
Right.
But the patient, you're telling them, look, you're obviously grinding.
Yeah.
And they don't want to hear it.
Oh, they don't believe me at all. They're like, no way am I grinding. I don't have headaches. I don't have sore muscles. But then you start showing them some pictures, and they see the wear on their enamel. And they start to realize, you know what, maybe I am doing something. And I'd say that probably 80% of us that grind don't even really don't know that we're doing it, because it's not always symptomatic.
It's like snoring or anything else. It happens in the middle of the night.
Yeah.
Okay, so let's talk about the treatments, and then we have to go to a quick break. But what are the treatment options?
Treatment options are anything from very conservative to just doing a night guard. Piece of plastic between your teeth. Second thing would be what we do is we balance the whole joint and the teeth together by getting rid of the strategic enamel in just slivers. I mean, this is not much. We have that 2 millimeters. At the most, we're taking away usually a 1/4 millimeter of that enamel. But you're going to wear through that anyway.
You do molds of their mouth, and then you just make the teeth fit together better?
And we make the teeth fit together better by getting rid of that enamel that's not in the right place. Now, if they have progressed too far, then we can't do that. we need to get the joint in the position, and then we need to restore it by doing braces. Sometimes the teeth are just in the wrong spot. And the other time, sometimes we do have to end up doing some new crowns or whatever so that the teeth have enough structure to last.
Okay. Yeah. And then, so the night guards that you do, these guards, how is it different than the over-the-counter for grinding? Don't hold back here, by the way. You look like you had to take a deep breath when I asked you.
Because I get this question a lot.
Okay.
And
because it seems like the same thing.
It seems like the same thing. What happens is the ones in over the counter that you're going to buy are bulky. And they're like, it feels like a mouth guard that you would wear to play football. Well, what happens, and then people start clenching on it because they're soft. And they're not like our regular teeth, and so they start biting on it more. And that can lead to more issues.
So it can create a bigger problem.
It can create a bigger problem.
So yours are what, just custom?
Ours are very custom and based off of making sure the joint's in the right place, that they're thinner and they're harder. And that sounds weird, but it actually causes your muscles to relax more as long as we have it adjusted appropriately.
Give me some miracle stories.
I had a patient that came in, and she just started to get some headaches. Right, and she just started getting some headaches, and she is a beautiful girl. Didn't look like she had a lot of wear, but I started to see some of those little subtle signs of some wear on her enamel, and even in my mind, I thought, surely that's not enough to cause that. But it was. And so all we did was we take the models, we took the photos, I did my background, and then we decided the best option for her was to balance the system. It's called equilibration. Just shaving off a little bit of enamel and then get her into a night guard. And her symptoms went away. It was amazing.
Like what? I mean, she comes in and says what?
She's like, I'm starting to, and we only found it because we started to ask some questions. Do you get headaches? She's like, yeah, I'm starting to get some more headaches. And so we started talking about about what she was doing at night and what was happening in the morning. When did she get the headaches? And we found out that they were in the morning, and it was based off of the fact that.
So headaches in the morning makes sense, right after sleeping.
Right after sleeping.
Grinding your teeth all night.
Yep.
Interesting.
Yeah. It was amazing because I thought there's no way, that's too little bit of wear to cause those symptoms. And the other people can grind their teeth away and they don't even have any symptoms. It's amazing to me how our bodies can adapt.
Okay, final message, somebody watching this and they have those symptoms.
Yeah.
How soon can you find out if they're a candidate?
Great question. You got to come in and you got to have some homework. We got to do our homework. I need my homework because I got to see, is the joint and the teeth balanced or are they not balanced? And so I need to take some impressions. I need to take some photos. I need to do my full muscle exam and check everything out. And very non-invasive, just a regular dental exam, nothing more than that. And it doesn't hurt. And we just, then I get to take that, and about 2 weeks later, I will have done my homework. We can see, do we think that this is an option for people or not?
Good. One of the things and that you wanted to bring up, you said, I want to talk about comprehensive dentistry. What does that mean to you, by the way?
Comprehensive dentistry means to me that we're not leaving out any one of those three things that would cause us to lose our teeth. We're not skipping over cavities. We're not skipping over minor gum disease or gum disease at all. And we're not leaving out the wear and tear in the joint. So it's comprehensive. You're looking at all three of the causes that will cause us to lose our teeth. And some of us may just have cavities. That's our main issue. Other people, that's not the issue. They don't have the bacteria that cause cavities. They have the bacteria that cause gum disease. Well, that's a totally different thing. And others, we don't have cavities, we don't have gum disease, but man, we're grinding the heck out of our teeth. We got to look at the patient as a whole. We got to look at all three of those. And if we don't, we're missing stuff.
I'm sold. That is comprehensive dentistry. I said, what does that really mean? And in dental school, they didn't teach a lot about
dental school, honestly,
TMJ?
Is that you get a little bit, but it's such a complex thing. You really need some experience out in the real world to see what's going on.
Is there a percentage of dentists that kind of focus their practice on TMJ?
If I were to guess, I would say that it's probably less than 5% that are really focusing on.
So look for somebody that's had
TMJ
extensive training. Yeah. You like that Dawson guy? That's where you got your training?
Yep. I love Dawson Academy because they're conservative.
He's kind of the legend in dentistry for teaching about bite. Is that correct?
Absolutely. He is the man.
Like the guru?
He's 80 plus years old right now, and he is still lecturing. Most of the time what happens in the lecture circuits is that they stop because they stop practicing. He's been doing this for 25 years after, and he still draws a crowd. He's a wonderful guy.
So obviously early treatment is less expensive.
Yeah.
I mean, if you do it early, you can get away with just a night guard.
We can get away with a night guard and that equilibration, and before we have to do braces and full mouth. Now, like you said, not everybody can do that.
Okay, good. I want to thank you for coming on the show.
Thank you, Randy.
It's great stuff.
All right.
Great stuff.
Yeah.